Well, folks battling addiction are showing doctors how to improve treatment. That might sound made up, but Hamilton County is trying something close. As WCPO 9 News reporter Larry Seward explains, this is part of a new strategy designed to slow overdose rates in minority communities.
2 years in a row, Ohio's highest drug overdose rate belongs to black men, and it's mostly those older than 55.
The myth is that black folks don't inject. I think that a lot of people are in my position are afraid to have that conversation. They're afraid to kind of point out the elephant in the room and the racial disparity.
But in Hamilton County,
we've been concerned for a couple of years now.
The trend involves others too.
Yesterday, there were 4 blacks, 44 whites, and 3 Hispanics.
Former county coroner Dr. Odell Owens still gets daily updates and sees racial disparities he attributes to treatments.
Blacks have been in crack where there's been no sympathy. Police departments were willing to accept opioids. If you want to turn your opioids in, yes, you could come in and not get arrested. They never made that offer for crack.
His wellness group Interact for Health asked whites and blacks about drug use. 76% of African Americans polled had family or friends with drug problems who've never been in treatment. The numbers for whites are half that. This comes as dealers are increasingly putting fentanyl in all types of recreational drugs, and hospitals are grappling with COVID-19.
We know we're not doing something right. We're not reaching them to our fullest potential.
Health leaders are making new partners.
Overdose disparities in Latino and black communities, mixed with solutions just tailored to one version of the problem, is bringing attention here to Price Hill.
Through a group called Cohere, people struggling with addiction virtually meet with and help county brass find better ways to attack addiction.
Of course, the everyday experts who should be at the table, not just to provide feedback, but to share their ideas for what would work as an intervention, should be people who either themselves or their friends or family have struggled with that issue.
They're just months into meetings and still brainstorming, but remain hopeful better days lie ahead. Larry Seward, WCPO 9 News.